Welcome back. We're just waiting for Dr. Girgis, and he's
I
with
know,
us.
I'm here.
There you go. Well, this is a very special panel as well, and I hope that we can basically have some good complementary, elaborative viewpoints from each other so that we can solve this crisis that's going on in the United States right now with these active killer events, mass shootings, active shooters. They're now being classified 100 different ways, and sometimes I wonder if the media is doing that intentionally to confuse us. But no matter what the case may be, there's innocent people getting killed in malls. There's innocent people getting killed at schools. There's innocent people getting killed at 4th of July parades. And the whole idea of us trying to mitigate and stop some of these crises is due to the fact that we want to go ahead and gather intelligence and try to mitigate it before the event happens. But obviously, there's been programs in place, whether they haven't been getting executed or they haven't had the right people behind it, that these shooters have been bypassing that first line of defense to gather the intelligence and mitigate it. So now it gets down to the fact that if you're a citizen who's actually a good guy or a good woman, because there was actually an incident, I believe, in Florida here where a woman actually stopped an active shooter event. Should they be authorized to do that to save themselves and others? And what are some things that we can understand about some of these killings that are taking place? That if guns weren't involved, would they still be a scenario that would be carried out? And these are all intangible things that the media does not get into. I'm not here to condescend or ridicule or criticize the media, but these are, when they talk about gun control, more guns, less guns, I mean, they're not considering these intangibles. And they're also on the opposite side, the conservatives, they want to arm teachers in the classroom now. And obviously, I've said this again already this morning, you know, everybody is preaching the run, hide, and fight scenario. But what happens if you've run and you've hidden and now you have to fight? How are you supposed to take on an active shooter with a fire extinguisher? So the bottom line is it gets back to what can we do to preempt and mitigate this, and what's the most efficient way to stop the killer from killing others? And before we get to that discussion, we'll start off with introducing Dr. John Lott. He can tell the audience a little bit about himself in a minute or less, and then Dr. Girgis as well from Columbia University. Dr. Lott, please proceed.
Thanks very much for having me on. You know, obviously this is timely, but just to mention, Russia just had a big mass public school shooting yesterday. At least 17 people were killed, 24 people were wounded. I don't think, you know, it's understandable why the attacks in the United States get a lot more attention than they do in the rest of the world, but if you have to adjust for population. And what you see is that the United States has 332 million people. The largest country in Europe is 80 million. Many of them have 5 to 10 million people. And when you adjust on a per capita basis, the United States is way down, even compared to many European countries. But anyway, my background, I've been an academic most of my life. I've had positions at the Wharton Business School, University of Chicago, Yale, Stanford, Rice. I was chief economist for the United States Sentencing Commission for a couple of years. And more recently, up until January last year, I was senior advisor for research and statistics at the U.S. Department of Justice. Right now, I'm president of the Crime Prevention Research Center, which is a group of academics who do research on all sorts of different types of crime issues, including mass shootings. But I'm happy to go into these issues more in depth.
Well, thank you. Dr. Girgis, it's a pleasure having you. We spent so much time on the telephone going over some things, and I'm very esteemed and honored to have your participation, particularly with the great things you're all doing at Columbia University in New York. I think you're one of the very few schools in your Department of Psychiatry that's really tried to take a proactive stance with these things versus just reactive in certain respects. And I hope I'm not off base by saying that, because I think proactive is good. But tell our audience a little bit about yourself.
Thank you, Jim. I appreciate being invited onto this panel. I'm a psychiatrist. I'm an associate professor of psychiatry at Columbia, as you mentioned. I am primarily a psychosis or schizophrenia researcher. And I believe I was invited because over the past several years, colleagues and I put together the largest database on mass murder in general, and in particular mass shooters in the world by far. And this database includes all publicly available or known personal cause mass shooters perpetrated between 1900 and 2019 all over the world. And we learned a lot about mass shootings in particular through our work on this database. And I'd like to share as much as I can during today's panel. So thank you again for having me on.
You're welcome. So we'll start with you, Dr. Girgis. What, in your opinion, what do your studies that you've done with this database show of what causes mass shootings? Okay.
Well, I'll start with the relationship between severe mental illness or psychosis and mass shootings. That was our primary objective when we put the database together. So as I mentioned, we focused on personal cause mass shootings, which is what most people refer to when they refer to mass shootings. These are mass shootings or mass murders in general, but mass shootings in which there is a personal motive. So not in the context of war, not perpetrated in the context of gang-related crime, not perpetrated in the context of any sort of organized crime, terrorism, state-sponsored anything. So that's our definition. We included any mass shooting involving 3 or more fatalities. So we focused on fatalities. I want to mention we also included this group of individuals who perpetrated mass murder committed with other methods, because as everyone knows, any data collection is subject to bias. So it's necessary to have a comparison group that limits or mitigates the bias. And so that's why we included another group, people who perpetrate mass murders with other means. Either way, we collected a total of 1,751 mass murders, the majority of which are actually mass shootings. And what we found is that among this group, individuals with psychosis or schizophrenia, those sorts of conditions, are much less likely to use guns to perpetrate mass murder. In fact, they're much more likely to use other methods. The numbers are about 18% for mass murder committed with other means and 8% among mass shootings. The specific numbers aren't themselves important. It's more the comparison that's important. That just demonstrates that there's really no specific relationship between severe mental illness and mass shootings. If we looked more closely, which we did, at mass shootings that are actually caused by psychosis, the number is a lot lower. And so what we find is that while people with psychotic illness are slightly overrepresented among mass shooters, they're slightly overrepresented by literally a couple percent, suggesting that trying to address mass shootings by addressing psychosis or mental illness in general, which we also did look at, and for which the story is about the same, will lead to few if any, changes in our rates of mass shooting. To say a few more things about this, we examined the contribution of psychosis or severe mental illness to mass shootings over time in the context of strategies that have been implemented to decrease the amount of mass shootings perpetrated by people with psychotic illness. And I'll refer everyone to papers published by my colleagues, Paul Applebaum and Jeffrey Swanson and those people. That number, or that proportion actually, has been decreasing over time. So over the last 50 years, the proportion of mass shootings perpetrated by people with severe mental illness, even just among this couple percent, has actually decreased 25%. Now, people might think, how does this make sense? I'll say a little bit more. So mental illness very slightly increases the risk of violence. It does general violence overall. We're talking about mass shootings, but general violence overall, slightly. The question is, how does mental illness and substance abuse, how do mental illness and substance abuse, or substance use in general, increase violence? So what is the mechanism by which they increase violence? There are a number of ways, but the primary mechanism is by impairing impulse control. And that's very important, because when we examine the effects of mental illness and substance use on violence, and on impulse control in particular, we find that this effect is primarily seen in women. The reason this is the case is because young men, who are the people who generally perpetrate violence, are very impulsive to begin with. So the effects of mental illness and substance use on impulse discontrol and then on violence are actually very small if you think about it mechanistically, and then of course just thinking about the numbers that I gave before. This is further supported by what we see among mass shooters. Virtually all mass shooters are males. A matter of a few percent are women. When women perpetrate mass murder, which methods do they use? They use other methods. 30% of mass murderers who use other methods are women. And as I said, those people are also, or psychotic people are also much more highly represented among that group. So as you can see, all the data kind of coalesce to suggest that there's really no link between psychosis and mass shootings. Addressing psychosis per se, which we should definitely do because we want that number to be 0, is important, but will ultimately do little to tide the overall number of mass shootings. So I'll stop there for now.
Well, this is why I wanted to bring you on, because there's a big debate, even amongst professionals such as yourself, what's mental illness, what's schizophrenia, what's psychoses, because we've been doing this for many years, and then I've heard different explanations on that. Yours seems to be the most coherent and the most balanced that I've heard, which is another reason why I wanted to bring you on. In that realm, or in that context, that doesn't mean that if the person isn't a schizophrenic person, or if he's not a someone that's suffering mental psychoses or suffering mental illness, that doesn't mean that he doesn't have other troubling things going on. And is that correct? I mean, there could be other troubling things going on that would drive a shooter to do this, other than those 3 things you've described. Can you touch on that?
I will touch on that now, and I'll be brief because I want to allow time for other discussion, and I also want to let Mr. Lott speak, obviously. Yes, I'll say 2 things. One, it's important that we distinguish between mental illness and then just any bad behavior. They're definitely different. What we find ultimately is that and we did this, so I mean the data are all out there. In general, the rates of all the different types of mental illness among mass shooters are very close to background levels, like population levels. So in other words, mental illness is primarily incidental. Number 2, I think a large part of society still equates bad behavior with mental illness, whether that's sin or bad behavior, whatever, and that's obviously a false equivalence. So while mental health clinicians and psychiatrists and psychologists and those sort of people may still be the best people to address any sort of bad behavior, including mass shootings, it's just wrong to say that mental illness is responsible for mass shootings.
Okay. Well, I'm glad you clarified that, because now that allows, because what's making these active shootings such a quagmire situation is what we discussed in the first panel. There's not enough preemption and intelligence gathering. And then the analysis standpoint of, still being able to keep people's rights and liberties in place, okay, is a little confusing too, at least to the people that aren't the PhDs like you and others. And we're trying to get through the weeds on a lot of these forms that we're doing right now. This way we can get the logistics in place that need to stop these events. And that's where I'll go to you, Dr. Lott. Essentially, you've done such significant work on this about hard targets and soft targets, and you're of the opinion that with a gun-free zone, those types of environments are going to be more apt or more proactive for the shooter to pursue. It's almost like the broken windows theory that we've spoken about in terms of, if you're not showing a presence, then basically, and doesn't necessarily have to be law enforcement, but people just being prepared, then, the shooter's going to basically look at that as a potential target. What can you tell us about that?
Yeah. Well, I just want to define a couple terms first, and I appreciate greatly the professor's comments. A mass public shooting is something where you have 4 or more people killed in a public place, not involving some other type of crime, as the doctor was saying, not involving gang fights over drug turf, or not involving a robbery that went wrong. we've put together a database over the 20 years from 1998 through 2017 around the world of 2,772 mass public shootings that involved a total of about 5,700 shooters. During that period of time, the United States had 62 attacks, 66 shooters within our country. And as he says, one can go through the different characteristics in the United States. About 97% of those are men, 3% are women. When you look at these things, you have people who want to commit suicide, but what was discovered a few decades ago is that these people who feel unappreciated, undesired, can get worldwide news attention by going and committing mass murder. So people will know that they were here. Time after time, when you read the diaries or other statements that these murderers have left, they've said their names will be in the history books. And they know the more people they kill, the more media attention they can get. They may be crazy in some sense, but they're not stupid. They know if they go to a place where their victims are unarmed, they're going to be able to be more successful in killing lots of people. And what you find is that these individuals spend at minimum, usually at least 6 months, some places up to 2.5 years or more. The Sandy Hook killer, for example, spent 2.5 years. He had done what police described as essentially a doctoral dissertation, where he looked at mass public shootings over the previous 40 years and graphed out the relationship between the number of people who were killed and the amount of media attention that they got. His goal was to go and kill more people than the Norway killer had killed, who had murdered 67 young people. You find about half of these mass public shooters in the United States over the last 25 years were actually seeing mental health care professionals prior to their attacks. There's academic literature that I'm sure the doctor can go and talk about, where there's a discussion about how difficult it's been for mental health care professionals to identify these individuals, in part because these killers are so rare. Generally, as he pointed out, people—
John, not to interrupt you, but if these mental health providers are looking for a textbook clinical description of what mental illness is,
right?
Okay, and although that these people may not be right in their mind for other reasons other than mental illness, that's a problem. I mean, it's not the fault of the mental health providers, because they're looking at mental illness as a distinctive certain way. Okay. So that's why I wanted to have this discussion, because we need to get our although it may not be mental illness or schizophrenia or psychosis, there's some type of behavioral issue going on here.
Right. Well, I'm sure the doctor is much more equipped to go into that more in general. I can just go and state what these guys have written in their diaries and manifestos.
Correct.
And they frequently state, they're smart people and they know what they have to go and tell the doctor. So you have something like, just look at the mass public shootings this year. The Buffalo mass public shooter, he had actually seen mental health care professionals last year. He had a teacher in high school had asked him what he was going to be doing over the summer last year. And he said, I'm going to go and find a school and shoot it up and kill people and then commit suicide. And so the doctor or the teacher had flagged him. He went and saw 2 mental health care professionals, and he told both of them that he was just joking, that, it was a dumb comment that he shouldn't have made. Obviously, and the mental health care professionals basically took him at his word. You look at the Uvalde school shooter. He was actually seeing a mental health care professional beforehand, had similarly been flagged, and had a similar type of discussion with the mental health care professionals. And so, I can go through and explain at least why the academic literature has said they find it so difficult to identify these individuals.
That's understandable.
To me, the bottom line, to answer your question directly, is these guys have a goal. They want to get media attention, and they want to kill people. And so what they do is, look at the Buffalo mass public shooter from earlier this year. The media gave a huge amount of attention to his manifesto, but what they leave out is his long discussion about how he picked the target that he did. He wanted to go and pick a target where he knew his victims weren't going to be able to go and defend themselves. He explicitly mentioned concealed handguns because he talked about how difficult it was to protect himself from people with concealed handguns. There was one armed guard there who was in uniform. The problem that an armed guard in uniform has is that they essentially have a neon sign above them that says, "Shoot me first," because the killers know if they take out that one person who has a uniform, who the only person with a gun, they're going to have free reign to go after other people. But you see this time after time. The Charleston church shooter had told friends that he had targeted the church because he knew people there wouldn't have guns. You look at the Batman movie theater shooter. He and his diaries had gone and talked about different targets and whether people would have guns there or not. We know that he had cased the different movie theaters around there. He picked the only movie theater. There were 7 movie theaters within a 20-minute drive of his apartment. He picked the only one that had signs banning permitted concealed handguns. Whether you look at the Omaha mall shooter or the Salt Lake mall shooter or the Portland mall shooter, you may have anything from 6 to 8 malls in those areas. And these killers, time after time, would pick the only one that had signs banning permitted concealed handguns that were there. One can go through many other cases there. The media really does people a disservice. When they go and cover these mass public shootings, they'll very frequently mention what guns were used, how they think the person obtained the guns, and they're frequently wrong in those cases, at least initially. But what they leave out is something that's very easy to go and check, and that is whether or not we've had yet another attack in a place that banned guns. You look across schools in the United States, there are 20 states that allow teachers or staff to be able to go and carry. It varies a lot in terms of the number of schools in those areas. You may have like 40% of the schools in places like Oklahoma or Texas now. You have Utah and New Hampshire, where any teacher who has a concealed carry permit is allowed to carry. And yet with thousands of schools, if you look at the data from 2000 on, every single mass public school shooting that's occurred, every single school shooting where anybody's been killed or injured, any attack, all have occurred in those schools where teachers and staff aren't allowed to be able to go and carry. Rather than having a sign in front of a school that says this school is a gun-free zone, possibly putting a sign there that goes and says, warning, select teachers and staff at the school are carrying concealed, will make a difference in terms of where these people attack. So I guess my bottom line is, even if the people are mentally ill in terms of schizophrenia or other types of things, I believe they're at least smart enough to know that what their goal is to try to go and kill lots of people. And they want to go and pick a relatively easier target to go after. I could go into much more detail, but that at least gives you a rough overview of what's going on.
Technically, they're violent bullies. They're looking to prey on people that aren't prepared to help themselves. They have a bullying attitude, but if they had to stand up to somebody that was going to meet them with what they're trying to do, they're looking to avert and avoid that.
As soon as you see somebody arrive at the scene, they very frequently run away. But you have 75% in the United States over the last 25 years, 75% of these mass murderers die at the scene. About 45% of them kill themselves, and the rest go and have what's basically referred to as police-assisted suicide or suicide by cop. mention one other thing, and that is when I was at the Department of Justice, one of the things I was tasked with doing was looking at the FBI active shooting reports, which have looked at data from 2000 on now. And the FBI, if you look at the 2014 to 2021 data, says that 4.4% of these active shooters, which is much broader than mass public shooting. These are any times where a gun's fired in public, could only be one person targeted, maybe nobody actually shot. But it's similar in the mass public shooting that it also requires it be in public, and it also requires that it not be part of some other type of crime. What I found was basically they had used Google News searches to go back and do these things, and there are real problems with the search method that they use. I was able to find a total of 25 additional cases where what would have been, according to police, a mass public shooting that was stopped. But if you look at active shooting generally, rather than the 11 cases that they said over that period of time, I find 129 cases where civilians legally carrying guns have stopped what otherwise would have been a mass public shooting or active shooting type case. And so it's harder to get cases that are further back in time. But if you look at the last 8 years, it's 34% of these active shooting cases were stopped by civilians carrying guns. If you look at 2021, for example, it's 49%.
That's understandable. Thank you for those points. Dr. Girgis, we really didn't discuss this at length, but just from an understanding as a behavioral health specialist, why would someone want to broadcast and put out there, either through the manifesto letter or even just posting on the internet, that they're looking to go hurt people? What type of behavioral health is that, or behavioral issue is that? If it's not mental illness, if it's not schizophrenia or being psychotic, what is that? Daring, unafraid behavior, or what? Because I think that's something that everyone's missed the signs with that, particularly here in Parkland, Florida, with Stoneman Douglas. The behavioral health people missed it. The FBI even missed it. I mean, they settled out for $100 million settlement with the families, local law enforcement. I mean, that's something we really need to get our hands around. Why would someone want to even brag or notify that they're going to commit such a heinous act, in your opinion?
Sure. I'm going to answer that question. I want to mention a few other things. First, I want to apologize to Dr. Lott. I refer to him as Mr. Lott, so my apologies. That was my mistake. Number two, and again, I know I discussed it with both of you. I don't want to make this a debate, and definitely not antagonistic, but I would like to address some of the things that Dr. Lott said, if that's okay, very quickly before I answer the question. I have a definitive answer to your question.
Okay.
I appreciate everything that Dr. Lott said regarding the size of the database and the numbers. The relationship between psychosis and mass shootings holds whether we use the 3 or 4 fatality definition. Number two, I understand that you have more than 2,000 mass murders in your database. We also found about 2,800 or 3,000. And again, we've published all of our data explaining why we use the smaller numbers. It has to do with sources and those sorts of things. I want to say 3 other things just about, because I think we're going to get to it probably, hopefully with during the second half of this panel, about really then how to prevent these sorts of things. And just to speak to what Dr. Lott said about the gun-free zones. And again, I'm definitely not trying to be antagonistic. I really want this to be a discussion. I really just want to share data. I did think about this, and I looked at our data specifically after I knew you, Dr. Lott, would be coming on today, and I reviewed some of what you previously said. And you probably know this, but there are 3 reasons why I think, and again, this is important, and again, not because I'm trying to debate, but because it's important that we do address whether arming people would decrease public mass shootings. And I think there are three pieces of evidence why that may not be the best strategy from my perspective. I want to hear what Dr. Lott says. Number one is what Dr. Lott said about suicide, that's real in the suicide by cop. These people, they want to be killed. So that suggests a lot of these mass shooters want to be killed, including by cop, the suicide by cop. So that suggests that they're actually looking for this sort of thing, and that knowing that they are going to die and wanting to die wouldn't necessarily be a deterrent. Number two, as Dr. Lott probably knows because he's reviewed these, mass shootings are much more common where guns are in plenty, both in terms of settings and in terms of, in America, states. So for example, this might be obvious, but this gets to the point. The rate of mass shootings on military bases is orders of magnitude higher than in gun-free zones, like in schools. And as Dr. Lott probably knows, because he has the data, there's an extremely strong correlation, significance of like P equals 0.001 or less, rather inverse correlation between the strength of gun laws and the prevalence of public mass shootings. So I will mention that. Now about the manifestos. Again, I'm not trying to debate it, but just to make sure I also share my perspective. I'm aware of the manifestos. I've read many of them, if not most or all of them. Those are unfortunately very common, and we don't want to use, and this is why I rarely just focus on specific cases, and I try to really talk about what we've learned from the hundreds and thousands of these that we've reviewed. First of all, these manifestos are very common. I see them almost every day, or at least every week in my area. Young people have these sorts of thoughts, and they publicize them all the time. And I spent 7 years in training to understand, or to try to identify which are, for whatever reason, more concerning than not. Those aren't actually a very good predictor of a mass shooting, unfortunately. So what is it? So that's just to speak to those. Now, why do people feel this way? Regardless, I mean, because we don't want people to feel this way. I will agree with Dr. Lott that a lot of these people, especially the school shooters, some of these public mass shooters, are empty. They obviously want to die because the plan is for suicide. They feel rejected by society. They're also, by definition, very narcissistic, and they desire a great deal of notoriety and infamy. And there are very few ways to obtain that, basically immediately, besides, unfortunately, using a gun and committing some sort of public mass shooting. I agree. I've heard Dr. Lott say this before, that one strategy for decreasing a subtype of these mass shootings would be to stop publishing any personal information about these people or photographs. That is one strategy that will work. There are others that I'd like to speak to, but I will stop there for now.
Okay. Dr. Lott, did you want to respond to the military installations or anything?
I'll respond to both the points. I appreciate the doctor's comments there. With regard to deterrent, yeah, they want to commit suicide. I agree with that. I mentioned that. But the thing is, you have to understand is they want to commit suicide in a way that will get them worldwide, or at least national attention. And so I'm not going to go and argue we need to get rid of the First Amendment, but this still gives you an idea of how to approach this problem and what to take away. And the thing is, if you can take away the notoriety that they're going to be getting by limiting the number of people that they can go and kill, then you can deter them from doing this type of crime. And the way you do that is by making sure that somebody's there quickly on the scene in order to go and stop them, and having signs that warn them in advance that says that, select teachers or staff are going to be able to have concealed handguns to protect students and others is just one example. But having gun-free zone signs there, whether it be a mall or a movie theater, actually attracts these individuals. It's a magnet, because they want to go to a place where they think they're going to be more successful in killing people so they can get more media attention that's going to be there. With regard to the point about the prevalence of these types of attacks, it's simply incorrect, whether it be where mass public shootings occur in countries around the world or in states. The places that have relatively more gun ownership actually have relatively fewer attacks. But, even in places where you have the mass public shootings occur in very tiny areas within those countries, those areas where guns are banned. With regard to military bases, for example, I don't know if the doctor knows this, but military bases are essentially a giant gun-free zone in terms of anybody other than military police being able to go and carry. Fort Hood, which has had 2 mass public shootings that have been there. My son was actually stationed there at the second mass public shooting about a block away from the attack. But if you're a soldier there, you're banned since the end of the George H.W. Bush administration, beginning of the Clinton administration, from being able to go and carry a gun around with you. The only people they're allowed to carry are military police. They're driving around in their Humvees. It's essentially just like cops driving around in the city. They're unlikely to be at any one particular place. The fact is, these killers take advantage of the fact that everybody else there was going to be unarmed. They can look around to see whether they're military police. These mass public shooters have huge tactical advantages. If you have an officer who's armed, they can either wait for the officer to leave the area, or they can go and pick another target. Or if they do decide to go ahead and attack there, they can take out the officer first, and then they have free reign to go after other people that are there. But, I'm happy to go through and show our published data that we have on this. But if you look around the world, the United States ranks about 62nd in terms of the rate of mass public shootings per capita. You have many countries in Europe, France, Norway, Finland. You have to adjust for population differences. You take school shootings, for example. Since 2000, we've had 9 mass public school shootings in the United States. Germany's had 3, one in which 18 people were killed, one in which 15 people were killed, another one, 4 people were killed. The thing is, Germany has less than 1/4 the population that we have here in the United States. So if you go and adjust on a per capita rate, that's the equivalent of 12. Finland has had 2 school shootings over that period of time, but they have a population of 5 million people. That's 1/60th the population rate that we have here in the United States. And so, you have to go and make those types of comparisons there and adjust for population. And when you do, the United States is relatively low. Now, that doesn't mean we want to get it to 0. And there are things that we can do about it, but I'm not going to go and argue that, I'd like to be able to do maybe what the doctor says, make it so that the media wouldn't cover these things. You have select people in the media who don't cover it, but enough others do cover it, and they cover it worldwide when we get these types of attacks. And these killers know this. And you'll even find statements from these killers that say things like, well, even if the media stops covering my name, I know I'll be in the history books. And you have difficulties in terms of law enforcement or other things stopping these killers because they want to die. They expect to die. Even the 25% who don't die in these attacks expected to die, but just couldn't bring themselves to go and kill themselves in the end there. And so, you have to take away their goal, which is media attention, if you're going to deter them from committing these horrible crimes.
Yeah, I mean, they're almost like quasi serial killers right now, and in certain respects, maybe not that specific description of what you just said, but you did an editorial for Newsweek, and we're going to get back to Dr. Girgis in a minute here. In terms of all the recent shootings, attempted active shooter scenarios that could occur, were people who were armed, other than the Greenwood Mall incident in Indiana, which we're going to have someone from their local news station on the last panel to discuss that. But I mean, you went into Fort Myers, Florida. There was recently a woman that basically saved lives, and then there was the Greenwood, Indiana issue, and the Charleston, West Virginia, and none of these scenarios garnered hardly any press coverage from the media. It's almost like the press is willing to cover the bad guys, but they're not willing to basically cover people that are standing up and saving lives. Why is that, in your opinion?
You know, it's kind of hard to explain some of these things, but you know, there are lots of examples that I can give you. You take the Pulse nightclub shooting in Florida, where 49 people were killed near Orlando. 1 week after that, there was an attack at a nightclub in South Carolina. 3 people were shot. A 4th person was being shot at when a permanent concealed handgun holder pulled out his gun and shot the attacker, seriously wounding him and ending the attack. You look at that, the Pulse nightclub shooting was still getting massive international attention when that other attack occurred. But you will search in vain for any type of national news coverage about the attack in South Carolina. What's the difference between those two places? Florida is one of 10 states that ban people carrying permanent concealed handguns in establishments that get more than half their revenue from alcohol. South Carolina was one of 40 states that allow people to be able to go and carry in those places. Obviously, you have the Parkland shooting. What most people don't know is just a little bit later that year, at another Florida school, an elementary school, was having a get-together at a park right next to the elementary school. A man came up, started firing his gun. There was literally hundreds of students there, as well as parents and teachers, started firing his gun. Fortunately, there was a vendor there at the park who had a permanent concealed handgun, wounded the attacker, ending the attack. Parkland was still getting international news coverage at that time. You would think that here you have a situation where somebody with a permanent concealed handgun had stopped what could have been a similar type of attack, would have gotten news coverage. But yet, outside of the local media market, it essentially got no coverage that was there. And I could go on with lots of other examples. Even in the few cases where the media does mention these things, they frequently get them wrong. So everybody knows about the synagogue shooting in Pittsburgh that occurred. Just 3 days after that, there was an attack at a Kroger grocery store in Louisville, Kentucky, where a racist had gone into the grocery store and was shooting blacks. What got national news attention was a quote from the murderer there to a customer saying, "Whites don't shoot whites." And but what was left out of the national news coverage was the beginning of the quote. The beginning of the quote was from the murderer, "Please don't shoot me. Whites don't shoot whites." So what he had done is he was pointing to a customer there who was white, and telling the white customer who had a concealed handgun and was pointing it at the murderer, begging the customer not to shoot the murderer, which puts a completely different spin on that story that was there. But in fact, one national news show that talked about it is actually dealing with the national host, Chuck Todd, at the time. And I sent Chuck links to local news stories that had the complete quote that was there, suggesting that maybe the next week he could go and correct the story. And of course, he never went back and kind of filled in the rest of the details that were there. I can give you dozens of these types of cases where you have dramatic, heroic events that occur that police have said would have been a mass public shooting that just don't get national news attention. My own guess is that the entire gun control debate that we have right now would be dramatically different if some of those got news coverage. And also, if once in a while the media would go and mention that we've had yet another mass public shooting in a place where guns are banned. Uvalde, you have over a third of the schools in Texas have armed teachers. Uvalde was at a school that didn't allow them to have it. You have the Buffalo mass public shooter. He explicitly explains why he picked the target that he did. You have the Tulsa hospital shooting earlier this year. You have a similar type of thing. Often these are easy things to find in like less than 3 minutes. I could find out that the Uvalde school shooting was yet another mass public shooting at a place where guns were banned. And, you know, again, you can have deterrence, but you have to get at the basic goal of these guys, and that is to get attention. That's the reason why they're doing this type of thing, and you have to take away the attention. And if you can't get rid of the First Amendment, and if you can't get rid of the desire for media to go and give a lot of attention to these things. But I agree with you. You know, it's kind of strange that on the one hand, you essentially turn these murders into celebrities, but the people who are heroic and stop these types of cases just don't get news attention.
Understandable. Dr. Girgis, I don't know if you have any responses to that, but I did want to ask you a question. You participated in an article, because we're getting short on time here. We have about 10 more minutes. You participated in an interview within an article that was entitled "Banning Guns Cannot Be the End-All Solution." How understanding, empathy, and other criteria are far more important. Do you feel that, let's just say, I mean, this isn't going to happen anytime soon, but let's just say there was a moratorium put on guns and things of that nature. Would these people use other means to carry out their objectives from a behavioral health standpoint?
Thank you for the question. Our data suggests that the answer to that is no.
Really? Interesting.
Pretty clearly. And that's, again, why it's important to review hundreds and thousands of these cases and have comparison groups. And again, these data are public.
I don't want to interrupt you because we're short on time. So if they're planning and preparing for these attacks and their objective is to hurt people or kill people, if guns aren't their repertoire of tool that's available to them, they're not going to use other means like pipe bombs or anything like that, because we have data from Columbine that was supposed to be a propane explosive attack. It didn't go off as they initially planned it, and then they diverted to plan B, which was, you know, just going into the school the way they did. But why if someone is planning and preparing for so long, why would they just stop because they can't get a firearm? I mean,
sure. And if I could expand just a little bit. First, I want to mention again, I think it's Dr. Lott and I we have lots of data, and I think we interpret the data somewhat differently. We also may have somewhat different data. Of course, I was always considering rates and, you know, per capita rates. Yeah. Jim, you're right that if there were no guns, and I want to show, so our data are clear that overall, so again, I'm not a policy person, I'm an academic physician. Yeah. Our data are clear that there is a relationship, without a doubt, between gun availability, weaker gun laws, and mass shootings. And so even if we were to put, you know, someone with a firearm in every school, in every public place, in the best case scenario, which is terrible, but in the best case scenario, that might slightly decrease the number of fatalities per incident, but the data suggests that would increase the number of mass shootings substantially. Again, we disagree about this, and that's okay.
Give me one example where somebody with a permanent concealed handgun has committed these types of mass public shootings. Why would it increase the number?
Just because of the data that show very clearly that gun availability.
Give me one example. But, you know, just on the main point there about, look at Israel. Israel, if you look at the history of mass public shootings or mass murders in Israel, what you find is that up until the 1970s, early 1970s, 1972, almost all the terrorist attacks there involved machine guns. after 1972, almost all the terrorist attacks involved bombs. Do you know what changed? They made it a lot easier for Israeli citizens to carry concealed handguns. Now, why did that make a difference in terms of the type of attack that they chose to use? The reason it made a difference is because if somebody pulls out a machine gun or a gun, you give others a chance to respond and shoot back. But if you have a bomb and a bomb goes off and it's a suicide vest that's there, there's really nothing to go and respond to. And so the killers switched the type of method that they use to go and kill people when you had it so that you had concealed handguns. But
I understand.
But we have data already. Give me one school shooting, one mass shooting, one attack of any size where people have been killed or injured at any of the thousands of schools in the United States that have teachers armed. Just give me one example.
Right, I understand. No, I understand. I understand. First of all, again, I don't like referencing specific examples. I acknowledge that I acknowledge that we are interpreting data differently, and that's okay. I don't want to belabor that.
That's understandable.
To primarily mention that we do examine we examine, obviously data on a per capita basis. Back to your question. So our data, again, I understand we'll disagree about this, Dr. Lott and I, but our data, again, all published in our primary paper, are pretty clear that if people were not to have or have access to firearms, the number of mass murders would decrease by almost 75%, probably. The data are pretty clear that it's not that people choose, decide that they want to perpetrate a mass murder and then choose a method. It's almost the other way around. They choose firearms to perpetrate mass murder. And that goes into a deeper discussion. I'm not sure we have time to kind of open up that discussion, but that's what our data show. And it's to some degree speculative, but it's also a theory based on pretty strong data.
Could that have anything to do due to the fact that all the things that you've been studying has involved a firearm? I mean, what if there were some incidents in there that were bombings? Because I'm sure that's another thing that doesn't.
All those.
Yeah. So you've examined all the bombing issues.
I've examined the bombings, the poisonings, the stabbings, the bludgeonings, all of them.
Can I ask one question? Do you use the University of Maryland Global Terrorism Database that's there?
The Global Terrorism Database? I actually am not aware of that database. I will definitely look at it. But again, we wouldn't count terrorism.
They have lots of bombings that I don't think you can have in your data set with the 1,000 that you were mentioning.
Because we wouldn't include terrorism. We wouldn't include.
No, but that's the title for their database. But they break it down by whether it's terrorism or other types of things, such as what not involving some other type of crime, the type of things that would fit the definition that you gave there. They actually have 4 different categorizations. Is it state-sponsored killings? Is it terrorism? So I'm just saying that's their overall title, but that doesn't mean that's the only thing that's in there, which may be one reason why you didn't look at it to begin with.
I'll look into it. No, I appreciate it. I've reviewed about 400 of these, which is a lot. Again, we're talking, I wouldn't necessarily have to reviewed all of them, but again, when we talk about comparing groups, and so, with large sample sizes, we can come to conclusions. And again, when you compare the groups, the mass shooters and the other types of mass murders, it becomes pretty clear that it's not, especially for the mass shooters, it's not about the fatalities. It's more about the firearm causing the fatalities.
So, Dr. Girgis, because we're almost about out of time, do you think people should have the opportunity to defend themselves, or that's not something you would consider as a scientist or a medical doctor, that if you're in a mall and there's someone that, like what we're going to discuss in the next 2 tracks here, that some people are proclaiming this young man as a hero, that he was able to neutralize the shooter from killing more people? I mean, does that calculate into any of your analysis at all, or not?
Right. Well, I think the question, I appreciate the question. But the question, if the question is how to decrease mass shootings, then the answer, one of the answers, there are many answers. I mean, one method is by decreasing gun availability, and how to do that is another question. I understand that's not necessarily a simple question, but if we want to decrease mass shootings, decreasing gun availability would be one method of doing that. There are other methods. I think that's kind of more, that'd be the answer to the question about how to decrease mass shootings.
Okay. All right, we're about out of time. In 30 seconds or less, if both of you, starting with Dr. Lott, can summarize and close out your comments.
Well, I guess I strongly disagree with the reduced gun availability that's there. You look at these cases that are there. These guys, you look around the world. France, for example, has banned semi-automatic guns. Yet they have a casualty rate from mass public shootings that's much higher than what we have here in the United States on a per capita rate. Finland, other countries that are there. Many countries, Germany, have very strict gun control. Russia, which has had a number of school shootings, just one yesterday, like 1% of the adult population is legally licensed to have a gun. The attack that occurred yesterday, the person had illegally obtained guns. I wish this was an easy thing to go and stop these criminals, but when you're talking about people who are spending at least 6 months, many times a year or 2 years, to go and plan these attacks, the notion that you're going to be able to stop them from getting a hold of weapons of some type is just simply not credible. What you end up doing by having these types of laws, unfortunately, is by disarming the law-abiding good citizens that are there. Look, I'll give you one simple statistic. There's no place in the world that's banned either all guns or all handguns and seen murder rates or homicide rates go down. Every single time. I mean, people know about Chicago and Washington, D.C., and gun control advocates will go and say, well, that just wasn't a fair experiment because unless you ban guns every place, they could still get them from Illinois or the rest of Illinois or Indiana or Maryland or Virginia. The problem is even whole nations that have banned guns have seen, even island nations, kind of the perfect experiment, every single time have seen murder rates go up. You would think out of randomness, one single time, you would see them go down or at least stay the same. And there's a basic reason for that. And that is when you go and you ban guns, and that applies to other gun control laws too. When you ban guns, it's the most law-abiding good citizens who obey the rules, not the criminals. And to the extent that you disarm law-abiding citizens relative to criminals, you make it relatively easier for them to go and commit these attacks. And so, I wish it was just easy to go and ban guns or to reduce availability generally. But I think what you often end up doing is accomplishing the exact opposite. If the doctor or somebody else can give me one single example where homicide or murder rates have gone down after a ban like that has occurred, I'd be very interested in hearing it. A complete ban on guns or handguns.
Thank you, Dr. John. Dr. Ragy, closing thoughts?
Just to mention, again, I appreciate being invited on. I appreciate being able to share.
We appreciate having you.
Our data with Dr. Lott. Just to be clear, our data are different. So our data show that rates in the US are much higher than in other countries per capita. So I want to be clear, it's not mental illness. Managing gun availability will help. However, I do want to mention there are other strategies that can use, much more upstream strategies that can be helpful. People focus on gun availability because that is one strategy and that is an umbrella strategy. There are other strategies more kind of proximal that I'd love to discuss at another time and we didn't really get to here.
Okay. Well, thank you. I would like to go on with this to finish, but we're about out of time. We're going to be having our next panel that's going to be discussing, it's actually going to be a presentation by Dr. Ragy Girgis and Dr. Tom DeMaria that's going to be discussing how to talk to your children about active killer tragedies. So thank you so much, Dr. Lott and Dr. Girgis. I look forward to keeping in touch with you. I thought this was a very good good discussion. My apologies for not earmarking another 20 minutes to this, but I think excuse me?
Thank you for your time.
Oh, thank you. I appreciate that. And I look forward to maybe doing this again in the near future. So thank you so much for joining us.